Many older adults rely on leftovers because cooking every day can feel tiring and expensive over time. Reheating food can be practical, comforting, and budget-friendly, especially when you live alone or have low energy. But here is the important point. Not every leftover behaves the same when you heat it again and again. Some foods change chemically with high heat, and some become riskier when storage and reheating are not careful. This video is health education, not medical advice, and it cannot diagnose cancer or any disease in your body. If you have symptoms, concerns, or a personal cancer history, please speak with your clinician for individual guidance. Today you will learn 5 common foods that deserve extra care when reheated, especially for adults over 60. This is not about fear or guilt, because leftovers are a part of real life and real kitchens everywhere. This is about small choices that reduce unnecessary stress on digestion, metabolism, and the hard-working pancreas. Your pancreas helps control blood sugar and supports digestion quietly, often without you noticing its daily effort. When we repeatedly expose the body to inflammation, food toxins, or harsh cooking, byproducts the pancreas can struggle more. Pancreatic cancer is often found late, so prevention habits and food safety habits can matter more than people realize. It can be difficult to detect early because early signs may look like ordinary stomach upset or vague back discomfort. That is why prevention is mostly about reducing avoidable burdens, not about searching your body for scary symptoms daily. Here's the promise you will get: clear examples, simple swaps, and easy rules you can remember without stress. If you stay until the end, you will learn 5 golden rules for leftovers that fit almost every meal you make. Before we name the foods, let us set one gentle but powerful guideline for older adults and caregivers. A single meal will not cause cancer by itself, but repeated patterns over years can shape long-term risk. Food risk is usually about frequency, temperature, time, and storage, not about one single bite at dinner. So, we will focus on what you can control: how often you reheat, how hot you reheat, and how you store. If you feel overwhelmed, remember this: you do not need perfection, you only need safer habits most days. A small improvement repeated weekly is more protective than a perfect plan you abandon after 3 days. Now, let us begin with the most common leftover in many homes because it surprises people the most. 1. Reheated rice. How to store quickly: reheat once and avoid avoidable stomach toxins over time. Rice looks harmless, yet rice has strict safety rules many families never learned. Rice can carry natural bacterial spores before cooking, and those spores can survive typical boiling temperatures. After rice is cooked, the danger period starts if it sits warm at room temperature for too long. In that warm window, bacteria can multiply and create toxins that reheating may not fully destroy later. For older adults, food poisoning is not just uncomfortable because dehydration and weakness can become serious quickly. Another issue is repeated reheating cycles because rice is often warmed again and again across multiple meals. That pattern increases the chance of uneven heating, where the outside is hot, but the center stays lukewarm. Lukewarm pockets are exactly where bacteria thrive, and your stomach pays the price a few hours later. Beyond infection risk, repeatedly reheated starch can affect blood sugar responses, especially in sensitive older adults. If you have diabetes or pre-diabetes, large swings in blood sugar can place extra metabolic work on the pancreas. So, the goal is not to avoid rice forever, but to store it fast and reheat it only once. Try this simple kitchen habit: divide fresh rice into small containers while it is cooling, then refrigerate promptly. Smaller containers cool faster, which reduces bacterial growth and keeps your rice safer the next day. When reheating rice, heat it until it is steaming hot throughout, not just warm on top. Stir midway through reheating because stirring helps distribute heat and prevents cold pockets hiding in the middle. If you cannot make it steaming hot evenly, it is safer to skip reheating and choose another option. A gentle swap is to cook a smaller portion of rice and add extra vegetables for volume and satisfaction. Another swap is oatmeal whole grain toast or fresh boiled sweet potato, which reheats more predictably for many people. Remember, this line, rice is safe when stored quickly, kept cold and reheated once until truly hot. 2. Processed meats. Why repeated high heat can increase unwanted byproducts in convenient breakfast leftovers. The more convenient the meat, the more careful you should be with extra heating. Processed meats include bacon sausage deli slices, hot dogs, smoked meats, and many ready-to-eat options. These foods often contain added preservatives and curing agents which can form unwanted compounds under high heat. When you reheat processed meats, especially until they brown crisp or scorch, the chemical load can increase. Some byproducts, including nitrosamine-related compounds, have been studied for potential cancer-promoting effects in humans. You do not need to memorize chemistry because the practical lesson is simply to avoid repeated high heat exposure. Older adults may be more sensitive to cumulative exposures because cellular repair and detox systems can slow with age. Also, processed meats are often high in salt and saturated fat, which can burden blood pressure and metabolism. So, this is a double reason to keep them occasional rather than daily breakfast staples for many seniors. If you love the taste, consider treating processed meats like a rare condiment instead of a main protein portion. A safer habit is to eat them fresh once if you choose them, and avoid reheating leftovers later. Microwaving processed meat repeatedly is especially common because it is quick, but it can heat unevenly and overcook edges. Overcooked edges can mean more oxidation and harsher byproducts, which is exactly what we want to reduce. If you want a warm breakfast, protein, try eggs, plain yogurt, tofu, or beans warmed gently in a small pan. Canned fish warmed lightly, such as sardines or salmon, can be another practical option for older adults. If chewing is difficult, consider soft scrambled eggs, lentil soup, or cottage cheese with herbs and olive oil. The point is not perfection, because it is progress reducing frequency and reducing aggressive reheating exposure. Keep this simple rule: processed meat is best limited, and it is best not reheated again and again. 3. Reheated leafy greens. How to keep the benefits while avoiding repeated reheating of nitrate-rich vegetables. Even healthy foods can become less ideal when reheated repeatedly at high temperatures. Leafy greens include spinach, kale, beet greens, and similar vegetables often cooked in soups and stir-fries. Many leafy greens contain natural nitrates, which are not automatically harmful and can support circulation in fresh meals. However, when cooked greens are stored and reheated repeatedly, nitrate conversion patterns can change inside the food. Some experts recommend avoiding repeated reheating of nitrate-rich vegetables, especially for vulnerable groups and infants. For older adults, the safer approach is simple: eat cooked greens fresh and treat leftovers differently. Instead of reheating greens multiple times, cool them quickly, store them well, and use them cold the next day. Cold leftover greens can work beautifully in salads, wraps, grain bowls, or mixed into yogurt-based dressings. If you prefer them, warm reheat, once gently using low heat, and stop before they darken and wilt excessively. Avoid scorching greens in a hot pan because burnt plant surfaces can create irritating compounds and bitter flavors. Another benefit of gentle handling is taste, because greens remain brighter, softer, and easier to digest for seniors. If you cook a large pot of soup with greens, consider removing a portion before adding greens. Then add fresh greens when serving, so you get the flavor without repeatedly reheating the same leaves. This small strategy keeps leftovers safer and keeps nutrients more stable across the entire week for you. If you need more convenience, frozen vegetables can be portioned and cooked fresh quickly with minimal effort. Remember, the message is not to stop eating greens. The message is stop heating the same greens repeatedly. 4. Reheated potatoes. Comfort food that becomes less ideal when reheated to dark browning and crisp edges. Potatoes are comforting, but crispy reheating can create compounds you do not want daily. Potatoes are rich in starch, and starchy foods can form acrylamide when cooked at very high temperatures. Acrylamide formation is higher when foods brown, deeply scorch, or turn dark golden, especially in frying and roasting. This does not mean a potato meal is dangerous, but it means repeated high heat reheating is not a great habit. Leftover fries, roasted potatoes, and pan-fried potatoes are the most common examples people reheat aggressively. When older adults reheat these foods daily, the cumulative exposure to browned byproducts can increase over many months. There is also a food safety risk if cooked potatoes sit out too long, because bacteria can grow just like in rice. So, potatoes have two reasons for cautions: high heat browning and improper storage leading to gut irritation. Here is a smart approach: eat potatoes fresh when possible, and keep leftovers for cold or gentle use. Cold boiled potatoes can be sliced with olive oil vinegar, and herbs for a satisfying and easy lunch. If you want them warm, reheat in an oven at moderate temperature, aiming for warm, through not crisp and dark. Avoid microwaving until edges become hard and brown, because that can concentrate undesirable byproducts in small areas. If you love crispy texture, consider making a smaller portion fresh and storing the rest without reheating repeatedly. You can also swap some potato meals with sweet potatoes, pumpkin, or beans, which may reheat with fewer browned edges. Remember, this one-line deep browning is the warning sign, because darker color often means more heat byproducts. 5. Reheated chicken and poultry. The most common leftovers that require careful storage and gentle even heating. Chicken seems harmless, yet reheating chicken wrong is one of the most common kitchen mistakes. Poultry can carry bacteria that cause food poisoning, and older adults are more vulnerable to dehydration and weakness. The biggest risk is not chicken itself. The risk is storage time, uneven reheating, and repeated reheating cycles. Microwaves can create hot spots and cold spots, leaving the center underheated while the surface overcooks. Underheated centers allow bacteria to survive, and overcooked surfaces increase oxidation and dryness over time. Another concern is fatty skin, because fats can oxidize under repeated heating, creating irritating aldehydes over time. You do not need to fear these words, because the practical lesson is to reduce repeated high heat on fatty parts. If you plan to store chicken, remove the skin before storing or trim it before reheating the next day. Store chicken in shallow containers so it cools quickly, and place it in the refrigerator promptly after cooking. When reheating, choose gentle, even heating, like a covered pan on low heat, or an oven at moderate temperature. Add a splash of broth or water, because moisture helps heat travel evenly and prevents surface burning. Reheat only the portion you will eat, because reheating the same batch again and again increases risk. If you cannot heat chicken evenly and thoroughly, it is safer to eat it cold in a salad or skip it. A simple swap is to use leftover chicken cold with yogurt, mustard, or olive oil, making a soft sandwich filling. The goal is to keep convenience while avoiding repeated reheating that creates both safety and oxidation concerns. Now that you know the 5 foods, let us make this even easier with practical golden rules. These rules are especially helpful for older adults because they reduce risk without adding stress or extra costs. Golden Rule 1: cool leftovers quickly and refrigerate promptly, because time at room temperature is the real danger. If food sits out for hours, bacteria have time to multiply, and reheating later may not fully protect you. Golden Rule 2: store leftovers in small portions, because small containers cool faster and reheat more evenly. Large, deep containers keep warm centers longer, which encourages bacterial growth and uneven reheating later on. Golden Rule 3: reheat only once, because repeated heat cycles increase both chemical byproducts and safety risk. If you keep reheating the same pot, you also keep opening it, adding new germs and new temperature swings. Golden Rule 4: heat thoroughly, aiming for steaming hot throughout, especially for rice, poultry, and mixed dishes. Stir halfway, cover the food, and do not rely on a warm surface as proof the middle is safe. Golden Rule 5: avoid aggressive high heat browning when reheating, because dark, crisp edges mean more heat byproducts. If you want crisp texture, make a small, fresh portion and treat leftovers as gentle, warmed food instead. Here is a bonus tip: label containers with the cooking day, because time is harder to judge than people think. If you are forgetful, use a simple system. Today's leftovers go on the left, older ones move to the right. When in doubt, throw it out because one wasted meal is cheaper than one hospitalization from food poisoning. Also remember, microwave reheating can be safer when done correctly with stirring and standing time after heating. Standing time means waiting 1 or 2 minutes, so heat continues spreading through the middle of the food. If you use an oven, cover the dish because covered reheating reduces drying and prevents burnt edges. Here is one more helpful reminder. For seniors, your body gives quick feedback after unsafe leftovers. If you notice nausea, cramps, diarrhea, fever, or weakness after a meal, take it seriously and hydrate quickly. Older adults can become dehydrated faster, so seek medical care if symptoms are severe or persist longer than expected. Also remember that pancreatic cancer prevention is not one trick. It is a collection of small daily protections. Not smoking, managing blood sugar, staying active, and maintaining a healthy weight all support pancreatic health over time. Food safety is part of that picture because it reduces unnecessary inflammation and gut stress across the years. If you have diabetes, chronic pancreatitis, or a strong family history, ask your clinician about personal risk and screening. Do not bring fear to that conversation. Bring curiosity and notes about your habits, because doctors value clear details. Let us quickly recap the 5 foods so you can remember them without writing anything down. First is rice, which is safe when cooled, quickly stored cold, and reheated once until steaming throughout. Second is processed meats, which are best limited and best not reheated repeatedly at high temperatures. Third is leafy greens, which are wonderful fresh, but smarter when leftovers are eaten cold or reheated gently once. Fourth is potatoes, which are fine, fresh, but less ideal when reheated to deep browning and crisp dark edges. Fifth is chicken and poultry, which need careful storage, even heating and fewer reheating cycles for safety. Here is the most calming truth: you do not need to throw away leftovers to protect your pancreas. You simply need a better system: cool, fast store, small reheat, once heat evenly, and avoid scorching. These habits protect more than cancer risk because they also reduce food poisoning and stabilize digestion. One last mini hook: the safest leftovers are the ones you plan for before you even start cooking dinner tonight. Cook with tomorrow in mind because portioning and cooling quickly are easier than fixing a risky reheating habit later. If you are caring for an older parent, set up small containers first, so storing food safely feels effortless and automatic. Small kitchen systems protect health quietly, just like the pancreas works quietly for you every single day. If you found this helpful, share it with a friend, spouse, or parent who relies on leftovers every week. If you want, comment on the food you reheat most often, and we can make a specific safety guide for that food. Thank you for watching, take good care of yourself, and I will see you in the next video soon.